to this computer. Okay. This is a very special day for us all, and I want to welcome Dr. Andries Kleynhans to our stage, my little stage here in Australia. And it's kind of pertinent to what's happening at the moment. We are in the midst of some changes in Australia in education, but I would like to start with introducing Dr. Andy Kleynhans, who was a former professor at RMIT University, which hosted the chiropractic school, as you may know. He studied at National College, which is now National University of Health Sciences in Chicago. And he went to high school in South Africa. And we'll start by welcoming you to our little podcast. Andy, if I may call you Andy, Dr. Kleynhans.
Indeed, Dr. Irano.
Call me Joe.
Happy to call you Joe.
You bet. And now, when did you land in Australia from South Africa, Andy? Or did you go straight to National from South Africa?
I was born in South Africa and went to high school in what's called the Free State, a very rural area that produces a lot of corn. And at the age of 17, I finished high school and went to Davenport, Iowa.
Ah, more corn, indeed.
Yeah. And the way I got introduced to chiropractic was that I had a back problem. And in the town close to where we live, young chiropractor had just opened his office. He practiced upper cervical specific chiropractic, and that helped my low back quite a deal. And so much so that I decided to go to America and arrived there at the age of 17 and graduated at the age of 20.
Wow.
The dean at the time wrote to the association to get permission to have me graduate and return to South Africa. And so I started practice at a very early age, and I had some memorable experiences. And, there's a lot that's said about chiropractic not being able to assist patients who have visceral problems. And yet the very first month in practice, I had patients with visceral problems who responded amazingly well. So nobody's going to convince me that chiropractic cannot do anything for visceral problems. And we now know, in studying neurology, I know that the somatovisceral reflex is indeed very, very effective and can be very much influenced through specific chiropractic adjustments. I don't think of chiropractic adjustments as just manipulation. And there's a big danger at the moment where people think that people that practice manipulation are doing chiropractic, and this is absolute nonsense in many cases. And but it represents a major threat to the future of chiropractic in terms of political medicine and distortion of what truly happens. I had a patient with metrorrhagia who didn't stop bleeding for months. I adjusted her lumbar spine and, of course, the entire spine with emphasis on the upper cervical area as well. And she was in town only for a week. And a couple of months later, I received a letter from her saying, soon after I left, the practice because she went to another town, everything returned to normal. And now I am pregnant. Now, that is so amazing and memorable that it's the sort of thing that you keep in your mind for the rest of your life.
Wow.
So having gone to Palmer, I would mention that I have the highest regard for what the Palmer College did at that time, and I assume later on. We had a medical doctor teaching us pathology. We had people teaching chiropractic in a very, very convincing way, like and the principles they've conveyed are still, with me at this stage.
What year was that, Andy?
What year?
Mm.
Yeah, I started in January 1958, the 158
Wow.
class. And the first lecture I attended was by Dr. Virgil Strang, an anatomist of note. He became president of the college many years later.
And in fact,
And
when I was there in 97, he was president. Yes. Amazing span of time.
Having mentioned Dr. Strang, I should add that he had a major influence on acceptance of chiropractic in Australia.
Yes.
Before I came to Australia, he was invited to give some lectures. And at the time, the chiropractors introduced him to a professor who was dean of a medical school at Monash University. And Dr. Rod Andrew, as he was known, formed certain ideas about chiropractic at that stage that enabled him later on, when committees were set up by the AMA, etc., to talk about what to do with chiropractic, or let's say chiropractors. He came out very much in favor of giving chiropractic an opportunity to develop in this country. And that's been very significant. He became a very close friend. And after he became Dean Emeritus, because he had retired, he helped us a very great deal. And he was most impressed with Dr. Scott Haldeman, who, of course, is a chiropractor, a medic, and had a PhD in has a PhD in physiology. And he mentioned him in very strong terms in giving evidence later on about chiropractic and why we should be registered, and why the course at what was then called Preston Institute of Technology should in fact be accredited. If you want to go back to Palmer, I'd be happy to do that. Uh, I spent some very memorable times there. I came from a poor family. I never realized that we were poor because my mother, and father supported whatever we wanted to do and so on. And but they couldn't afford to pay for my tuition, so I had to work my way through school and started with working as sort of like a checkout boy in Eagle Foods store, and packed up groceries for people and carried it out to the car. And if I treated the people very nicely, I made enough in tips to pay for the food for a week. And so I could pay my tuition. And later on, I got a much better job. I was working for a photographic company and had to develop a lot of films that I had to go and pick up each day when I delivered the prints. And I did that for several years and had some other jobs in between. But that was wonderful. Yet I could find the time to study and graduate.
And how did and I guess it's not an uncommon story for the early Palmer graduates. However, how did you progress to National College after that?
I went back to South Africa, set up in practice, as I mentioned, had a very successful practice. Part way through the year, I brought in an associate who was a Palmer graduate, and we saw 120 patients a day, but spending sufficient time with them. That's like going from 7 in the morning till 11 at night. And of those, I usually saw 80. And I yearned, however, to know more about chiropractic and different methods, etc. So I got married at the end of the year that I was in practice, and wanted my wife to experience America. So we went back to Palmer for a quarter, and then went to Chicago to National, and she took short courses in radiography, know how to take x-rays, and that type of thing, so she could help me in practice. And we spent the rest of that year at National. Went back to South Africa and again set up practice, worked very closely with my wife in practice, doing the x-rays and helping with some soft tissue work. And I felt I wanted to study more. So whilst running a busy practice, I went to university and did a Bachelor of Science, like you did before you went to Palmer. And my majors were in biochemistry and physiology and psychology. So I completed all of that successfully. And Dr. Jansley from National came across to South Africa, as he had done a number of times. And he also, of course, went to Japan, to Australia, and that type of thing made a major impression on the chiropractic world wherever he went.
You did.
So Dr. Jansley came to South Africa, and I chatted to him, and he wanted to to know if I want to go to national and teach there.
Ah,
And so that's how I wound up at national. Whilst at national, in the on the first visit after Palmer, I did a lot of work in the diagnostic sciences and so on. But when I went to national to work there, and a major reason for going back to national was so that my wife Rita could get her Doctor of Chiropractic degree, which she did.
oh, I didn't know that.
Yeah, she studied hard and completed a Doctor of Chiropractic degree and helped us a lot when we first established the program in Australia with supervising clinical work and that type of thing of students. So when I went to national, I was asked to initially to head up the chiropractic department, which I did, and I taught many hours of chiropractic science. And a lot of the national graduates from the era that I was there actually got all their chiropractic skills from me, basically. And
Wow.
then after a number of months, Dr. Jansi asked me to head up the clinical sciences division, which I did, besides teaching all the chiropractic. And then very much later, after what was called the NINS conference, the first major conference about chiropractic held by the National Institute of Health, and within the NIH, National Institute of Health, there was an institute called National Institute for Neurological Disease and Stroke. That's NINS. And NINS set up this conference. And later on, NINS had to assume responsibility also for communicative disorders. So it become NINCDS, but that's a side note. And the NINS conference was a major milestone for chiropractic. And it encouraged the establishment of research. And this is not long before I left National. I became director of research without losing any of the other responsibilities. I still had to teach all the chiropractic and look after the clinical sciences division.
Extraordinary. And so the transition to Australia from there, shall we move on to that?
Dr. Jansi, during the last year that I was at National, Dr. Jansi, had previously visited Australia a number of times, but he had correspondence from Dr. Stanley Martin. Dr. Stan Martin is one of the heroes of Australian chiropractic, and I can't applaud him enough. And may he rest in peace. He did a wonderful job. And Dr. Stan Martin wrote to Dr. Jansi and said, here in Australia, they have been told, chiropractors have been told to establish chiropractic education, because chiropractors asked the government to be registered. And the government said, well, to become a chiropractor, you have to go overseas and get a qualification. That means that you are creating a group of people who are putting themselves sort of in elite position we need to have chiropractic taught in Australia, and then we can register you.
Mm.
So Dr. Stan Martin wrote to Dr. Jansi, talked about this, and said, look, can you suggest anybody that can help us set up a program here? Before going on with that, I should mention that at the time, Dr. Anthony Hart, second generation chiropractor in Australia, and with a sister who was a qualified chiropractor, and two sons who had studied chiropractic
Yes.
at Cleveland in America. He then set up a committee to establish what became known as the International College of Chiropractic.
Yes, ICC.
His eldest son, Dr. Christopher Hart, had just recently come back from America with his qualification. And Dr. Chris had, in fact, been a motivating influence on his dad to get a college started. And then his dad went to a meeting of the Chiropractic Association, Australian Chiropractic Association, and a number of people agreed that they should set up the college. They pledged money, they pledged cash in order to get this going.
Yeah.
And Dr. Anthony Hart invited his sister, Dr. Cynthia, to, in fact, come over, and they started teaching very, very basic work. And at that time, the Royal Melbourne Institute of Technology agreed to present some very basic science courses through its commercial arm, which was called TechnoSearch. And TechnoSearch liked earning money from this chiropractic venture. And so they, as a fee for service, taught basic biology, etc. Dr. Cynthia taught histology, but more importantly, taught the basic chiropractic sciences like chiropractic philosophy and also chiropractic procedures and so on. They had to have a facility where they could teach this. And that facility was a building in what's called Little Collins Street, a very humble address in the center of a city. And it's a building that had been designated for revamping, for demolition.
Yeah.
But they were able to hire this facility from one of the biggest insurance companies in Australia, financial companies called AMP. And so they got it at quite a reasonable rent. In order to make the place viable to run classes, a number of chiropractors and their wives, and I take my hat off to all of them, they went and they physically cleaned up the place, made it suitable, respectable, and they bought a whole lot of desk chairs, chairs with a flap on them. You can write notes on that flap. So that was an admirable start to the ICC. And all of that happened at a time where Dr. Stan Martin then wrote to National because they knew Dr. Jansi and, hoped that he would be able to help. So Dr. Jansi sent them, I think, 3 names and suggested that they could contact those people and see whether they can find somebody to come to Australia. So Dr. Stan Martin looked at my CV and saw that I was a Palmer graduate. And because I had studied at Palmer, I have my degree from Palmer, the search committee that Dr. Stan chaired suggested that they should approach me. And that's how I became involved. I took a loss on my salary, which at that time at National was $15,000 a year. I took a loss on that and with good faith packed up my family. Rita had just graduated, and so within weeks of her graduating, we came with our little girl and little boy and started a new life in Australia.
And what year would that have been?
That was in 1975 on the 1st of September. And that weekend there was a major conference at the Lakeside Hotel in Canberra. And the week before the conference, after we'd arrived, Dr. Stan Martin, incidentally, picked me up from the airport. I should have mentioned my wife and the 2 kids went to South Africa because they hadn't seen, grandpa and grandma and what have you for years. Yeah. So she went there with the kids to allow me time to get settled and find a place to live. But Dr. Stan, as a side note, he put me up in his son's room, and I stayed there for 3 months until my wife arrived. So he and his wife, Sue, were very, very generous, very, very kind, wonderful people. So after my arrival, during that the first week, I met Dr. Graham Hunt. Yes. And Dr. Graham Hunt was president of the ACA at the time.
Yeah.
He, of course, was a very, very special human being and very persuasive, very, very persuasive. And I'll tell you more about that later on.
Yeah, I think so, yeah.
But Dr. Hunt listened very, very carefully. And I told him about the Council on Chiropractic Education in America. I told him about what was then called the North Central Association of Colleges and Universities and so on. North Central for short. They have changed the name since then. But North Central was, and its successor is, the highest authority on education in the United States. And I told him that, it is absolutely necessary if we're going to do chiropractic education here we need to have a high level accrediting body, external accrediting body. And at the time, they had the Australia and New Zealand Committee on Chiropractic. And I suggested to him, look, this really should be a council on chiropractic education. And he took the bull by the horns, so to speak, and got agreement from the association and so on to establish the Council on Chiropractic Education. And that idea, of course, was very strongly supported by the late Dr. Doug Winter.
Yes.
Yeah.
Yeah. Yeah.
And
Yeah.
Dr.
Enormous contribution.
Yeah.
Mm.
Dr. Doug Winter actually wrote to me after Dr. Hunt had written to Dr. Jancy and so on. Doug Winter knew me. I stayed with him and his wife Shirley in a flat in Davenport, Iowa, for a period of time. They had an extra room that I could rent, at the phenomenal cost of probably $10 a week that I could afford. So tuition was $40 a month. I could afford that too out of my earnings. That's a side note.
The tips.
So back to the meeting, a very, very important meeting at the Lakeside Hotel in Canberra in early September. And Dr. Hunt had the vision of doing great things for chiropractic in Australia, which he did. He carried through with a lot of things that people had hesitated about. And also of benefit was the fact that I believe an uncle of Dr. Hunt was a previous minister in the Victorian government. And he talked to the chiropractors and told them to, get themselves properly organized and stuff like that. And the last health minister in the previous government, Dr. Hunt, also a relative of Graham Hunt. So there are a number of decisions that were made that were influenced and pushed through by Dr. Graham Hunt. So after the meeting in Canberra, we had to get on with the business of chiropractic education. Now, the major reason why there was a big push for chiropractic education was because the government at the time and the premier especially, whom I had the privilege to meet. I also met some other ministers and so on, both state and federal, in the process of getting education established at an appropriate level. And the premier, the government at the time said, set up a proper higher education program. And the association didn't really know where to go with all of this. And Dr. Hunt knew that a mate of his who had graduated also from the Canadian College, Dr. Bob Brodie, who was practicing in a place called Footscray here in Melbourne. Dr. Bob Brodie was friends with Dr. Doug Mullen. Yeah, and this doctor was not a medical doctor, a scientist, was head of Footscray Institute of Technology. And so Dr. Brodie and Dr. Chris Hart and myself went to see Dr. Mullen of Footscray Institute of Technology. And he was very, very sympathetic to chiropractic. But he said, look, they recently redid all our science labs. And at that time, they had the idea that you should have very small labs and smaller groups so you can teach them effectively. And yet what we were looking at were labs big enough to take, at least 30 plus chiropractic students, because that's about how many the Doctor's Heart started with.
Mm.
And he said, in Preston, there's a big new building, 10-story building that they had built for engineering. However, the demand for engineering has dropped totally, and they're not going to proceed with engineering because the government will not fund places for more engineers. Why don't you go and talk to them? So Dr. Chris Hart took me to Preston Institute of Technology, where I met Don Letcher, the vice principal. And he was the head of the School of Applied Science. And the principal, had told him to meet with us and see what all of this is about and so on. And so lo and behold, Don Letcher, who is still a very good friend of ours, Don Letcher's wife suffered from asthma. And she got distinct relief from going to a chiropractor here in Melbourne, and had been a chiropractic patient for quite some time. Here again, an example of a visual condition, of course, that chiropractors can do nothing about, and yet she got that much relief that this led, in fact, to the introduction of chiropractic into the higher education system in Australia.
Amazing. And we'll get on to from visceral to pediatric soon.
Pediatrics in a while.
Yeah.
Let's just with Preston Institute of Technology, because of the engineering hitting rock bottom and the course never starting, and Preston having a beautiful 10-story building with dedicated labs, fantastic labs for chemistry and they etc. They already had a physical education and human movement science department, and they were teaching anatomy and physiology, and I have a very, very great respect for the people from that department, and I wish I could talk about them for a while at some stage. But
we may do.
Be it as is, the Institute, under the leadership of Dr. James Barry Ritchie. They called him JBR for short, or Barry Ritchie. I would suggest that Barry Ritchie is the person that probably deserves the greatest tribute and appreciation for getting chiropractic education accredited and funded within the Australian university system.
Barry Ritchie.
Yeah, Barry Ritchie, indeed. Phenomenal man. I'm still in touch with him. I'm writing a book about the early days. I get so
Good.
many distractions that it takes time to get the thing done. But he has written a section for me about himself, and I dedicate the book to him. It's a major tribute to Barry Ritchie. Now, what happened then was that Barry Ritchie persuaded the council to send him over to America, went on a trip to America, visit some chiropractic institutions, and what have you. About the same time, the Victorian government had decided that they would take a close look at chiropractic, and they sent 2 people to America to see what this was about. One of them was Mr. Jens. He preferred to be called Dr. Jens, but he was probably the leading orthopedic surgeon in Victoria, major orthopedic surgeon, and he practiced at St. John's of God Hospital in Ballarat. And he met Dr. Jansi at National. And later on, when I met with Dr. Jens, Mr. Jens, he talked about the great Joseph. He was so impressed with Dr. Joseph Jansi, president of National at the time. And he served on committees and helped us to get the course accredited. And so there was a massive lot of work that had to be done. National, which is now National University of Health Sciences, was kind enough to let me take all their curricula. And I used all their curricula in order to develop the curriculum for the chiropractic program at Preston Institute. And the curricula had to be put forward to endless committees because of the way the system worked. And just a note on the curriculum, whilst it was the curriculum from National College, the chiropractic sciences were, the chiropractic sciences that I taught in America, and I added to that, and was the first chiropractic curriculum in the world that had a subject called spinal studies, and that had spinal biomechanics and so on in the first year of the course.
Amazing.
Yeah. So talking about accreditation, we were told very early in the process that the government will not accredit a course unless it is funded. In those days, fantastic for students, all bachelor level courses or initial courses in universities were free, no tuition for students. phenomenal.
Incredible.
Yeah. And so to get accreditation for the course and therefore the funding for the course, we had to have academic accreditation. And the academic accreditation went through a body called CTEC, Commonwealth Tertiary Education Commission. And that was the highest level for accreditation of academic programs at the time. CTEC accredited courses on the recommendation of state-based accreditation. And in Victoria, we had a body, the highest level for accreditation of courses in Victoria was the VIC, Victoria Institute of Colleges. And the Victoria Institute of Colleges had set up committees. Whenever there was a demand for a course to be accredited, they would go to the universities and colleges and look for people with the expertise to conduct courses and accredit courses. And so at the time, there were people from various disciplines, including medicine, invited to sit on the VIC committee to accredit the course. But before a course could go to the VIC, it had to be accredited by the institution intending to present that course. So Dr. Barry Ritchie and Don Letcher set up what was called the Course Advisory Committee on Chiropractic. And I prepared the documentation, a detailed curricula, philosophy of the course, and the philosophy of the course had things in it like in order to become a primary contact practitioner of chiropractic, a person had to have a broad understanding of the human body, had to be able to do this, that, and that, talking almost in a chiropractic philosophy manner. The people that sat on that committee included 2 people nominated by the AMA, Victorian branch, because the medics had an interest in this. Fortunately, in those days, or at that time, the people that were nominated, one was a radiologist and the other one was an anatomist. And they were from institutions, and they treated us well. They were very, very good. Also appointed to that committee was the retired professor from and head of the medical faculty at Monash University, Professor Rod, oh my goodness, I'll get back to his name. And so we had some powerful people on this committee. The orthopedic surgeon, ex-dean of medicine, members appointed by the AMA, Australian Medical Association, Victoria. And yes, and then there were also people, of course, from the School of Science and that type of thing. And we had chiropractors on it. One of them was Dr. Larry Rosenbaum. He was one of the star students we had at National, and he also went to university in America to earn additional qualifications, and he became a leader in Sweden. He married a Swedish student who then they came to Australia. So this committee sat and looked at the program and agreed that it was suitable, it met requirements for accreditation, and so it went from the Institute's Course Advisory Committee, then to the Victoria Institute of Colleges, and from there to the Commonwealth or the National, in other words, Commonwealth Tertiary Education Commission, got accredited. And then after the accreditation, we also had to make sure that we obtain funding for the course. Whilst it's was implicit that courses that were accredited would get funding, they still had to go through an application process to the relevant minister and had to be approved for funding. And Dr. Sweeney, who was president of the association then, after Dr. Hunt, he also played a very major role in getting chiropractic recognized. But Dr. Sweeney and I went and saw the minister, and students then suggested Dr. Paul, who's now Dr. Paul Perkulidis, but Paul Perkulidis was the president of this student organization. You know, the around about 30 students we had at this campus in the city that I talked about. He then suggested that he take a busload of students to Canberra in order to get the point across. And they actually went. We specifically told them, don't mention us, we don't want to be involved, and so on. And we're very happy for them to go, but you know, we could not support them, so to speak. So they went and had a candlelight. That's their idea. Was their idea, a candlelight vigil at Parliament House in Canberra.
Wow.
And you know, take your hat off for the students. And those students eventually graduated, and they have become leaders. They've become very influential people throughout the world. The head of the Barcelona Chiropractic College,
Adrian.
Yeah, one of our graduates.
Adrian Wenban.
Yeah. And so we then received word that the course could be taught. Government funding came in the year after, and it developed from there.
Wow. We should jump a bit because we're just over an hour, but I have all the time in the world, although, you know, we could just regroup another time. But I do want to say that you were there for about, what, 17 years? As head of the... a long time, anyway.
I resigned in 1999.